Epidemiologists estimate that nearly half of all Americans have heart disease, and it's estimated that that number is going to increase to 61% by 2050. But this is a shocker. Most people with heart disease don't even know they have it until they develop heart-related chest pain, have a heart attack, or a stroke. I'm Dr. Ayo Bankole, and I'm a state licensed and practicing naturopathic doctor, and I focus on regenerative therapies and root cause analysis, treatment, and prevention of cardiovascular diseases like hypertension, abnormal cholesterol, and arterial disease, especially as it relates to lifestyle and environmental toxins. Now, can you imagine having heart disease severe enough to have a heart attack or stroke while not even knowing you have it? Well, it's extremely common. Over 40% of Americans may have atherosclerosis or hardening of the arteries caused by plaque deposition, immune activation, and inflammation. And according to one review article, 25% of people with heart disease who lack traditional risk factors like diabetes, hypertension, smoking, or high cholesterol were later determined to have atherosclerosis by a coronary CT. So since 40% of Americans have atherosclerosis and since heart disease is the #1 cause of mortality in America, why in healthcare do we stop screening and treating heart disease at these risk factors? Why are we not screening for the hundreds of other risk factors for heart disease? And why are we not widely screening for arterial disease? Well, maybe it's because prescription drugs and surgery don't really address the majority of these other risk factors. Or maybe it's because better prevention would minimize the need for costly surgical interventions like bypass surgery. Whatever the reasons for our medical system's failure to embrace screening for non-conventional risk factors for heart disease, I believe that this blind spot will contribute to a future where we see rates of cardiovascular disease and its complications like heart attacks and stroke increase, and will ensure that heart disease will be the #1 cause of death in America for the foregoing future. So what can you do? Well, ask your doctor to screen you for common non-conventional risk factors. Consider the important role lifestyle and environment play in the onset and development of heart disease and address accordingly. And consider early screening for arterial disease with a CT angiogram or at least a coronary calcium score. For more tips on heart-related health, like and subscribe and look out for my next video.